Hello, everyone. In today's presentation, we are going to discuss the maternal mortality issue in Spain, Brazil, and the United States. Maternal mortality is the fatality of a woman during pregnancy, childbirth, or 42 days after delivery, which is a current critical issue that affects women around the world. Maternal mortality remains a significant public health concern worldwide, with several women dying each year from preventable causes related to pregnancy or childbirth. While progress has been made in reducing maternal deaths globally, there are still disparities struggling with this issue, especially in low and middle income countries. While there has been a global decline in the maternal mortality rate, we still have disparities that are at high risk. Factors such as limited access to quality healthcare, socioeconomic inequalities, and cultural barriers contribute to this continuous high maternal mortality rates in these regions. Spain has one of the lowest maternal mortality rates in the world thanks to the robust healthcare system and the comprehensive prenatal care. This may vary slightly throughout the years, but overall remains low. And they have about a 3.47 per 100,000 births per Spain mortality rate, and it continues to decrease over time. However, Brazil has been increasing due to the COVID-19 pandemic. Before the COVID-19, it was 57 per 100,000 births, but then in 2021, it drastically increased to over 1,500 deaths due to COVID-19. And like Brazil, the maternal mortality rate in the U.S. has increased since the COVID-19 pandemic began. It went from 20.1 to 32.9 per 100,000 births from 2019 to 2021. And this situation continues to worsen over time for the United States. And despite all the low mortality rates that Spain has, the common causes of maternal death include hypertensive disorders of pregnancy along with obstetric hemorrhage. Also, maternal age plays an important role for this issue. Women 40 years of age or older have a 3 to 5 times higher than other age groups in Spain. Challenges related to maternal mortality in Brazil include women not receiving early action for when it is necessary, and physicians who are not supportive of equality and racist towards patients can increase Black Brazilians for having a higher risk of maternal mortality. And factors that relate to the increase in maternal mortality for the United States relate to chronic health conditions, access to healthcare, and adequate postpartum care. Women living in low-income households may struggle with being able to afford health insurance, and it results in not getting proper care throughout pregnancy and postpartum. Spain has a universal healthcare system, and this is guaranteed to all residents. This includes universal coverage, and it's funded by taxpayers, and it leads into number 7 in the world for healthcare. And in Spain, Brazil also has a universal healthcare system, and this guarantees residents to all have health insurance as well. However, they do not have as high quality compared to Spain and especially the United States, and this includes one of the factors to their maternal mortality rates. And unlike Spain and Brazil, the United States does not have a universal healthcare system, and instead we have programs such as Medicare and Medicaid for healthcare insurance. Each month, us citizens have to make payments to the health insurer so our insurance company can cover all or some of our medical costs, but we do have high quality care and top-notch medical professionals. Within these 3 countries, disparities towards race and immigration are a common high risk for maternal mortality. The likely reason for the disparities in Spain is due to the south border of Spain having immigration from Africa. And disparities have a higher mortality rate with immigrant women from less developed countries. In Brazil, is Black women due to racist practices in the Brazilian healthcare system, and the existence of racist and poor healthcare for these pregnant Black women leads to higher risk of maternal mortality. And then in the United States, the higher risk for maternal mortality rates are for Black, Hispanic, and Native American women, which is typically in a lower socioeconomic status. Racism and access to our healthcare system are large factors of why the U.S. has a higher percentage. The healthcare system and government both play significant roles in Spain for finding solutions for this issue. The healthcare system helps many women in poverty to get the care they need. However, and also in Brazil, they have a decrease in maternal mortality by expanding access to maternal care, such as training healthcare professionals more advanced and improving the quality of monitoring their patients' health. The Brazilian government also would like to spread awareness by using campaigns to educate women and show the early signs of maternal health issues. The U.S. has key interventions to improve maternal health outcomes, which include integrating multidisciplinary care for women with high risk and addressing structural racism and social determinants within the healthcare system. And a call to action, advocacy efforts and raising awareness about maternal mortality are important for driving a difference. By amplifying the voices of affected communities, campaigns can bring attention to the systematic issue relating to maternal mortality. Raising public awareness helps normalize discussing about maternal health and encouraging more support. And my conclusion for today is maternal mortality is a complex issue that requires multi-phase approaches and cooperative efforts at local, national, and global levels to make sure that every woman has access to safe and equitable care. Thank you guys for listening today.